Hello, and
Hi.
welcome to January's Wellness Woman feature. Today we're talking to Dr. Amanda Cohen of Source Point Wellness. She is an acupuncturist and a functional medicine doctor, and I have specifically been working with her myself for probably 4 or 5 months now, I
Yeah,
think.
I think six, maybe. Yeah.
Maybe 6 months, yeah. And it's been life-changing, amazing.
Oh,
Yes, we've been working through hormonal balancing, gut health, which has been something I've been really working on and have just made some major breakthroughs since I've been working regularly with you. So,
so happy to hear that.
yes, so welcome and thank you so
Thank
much for
you.
doing this and being here today.
Oh, thank you so much. Thank you for having me.
Yes. Um, so I just wanted to, I like to kind of let everybody know what area that you're in. So you're in Atwater Village.
Mhm.
And how long has your center been there?
So I've been in practice for 10 years. I started in Beverly Hills and then Los Feliz and then like in the beginning of my practice, like 10 years ago. And then it was always Source Point Wellness, but I was like working out of other people's places, which was amazing. But then it was sort of time in 2019 to open up my own place and really create the vision that I wanted to create a healing center where
Mhm.
everyone works together because so much of we can talk about this going forward. So much of my personal experience in medicine is that you see one doctor for one thing and then another doctor for another thing and no one talks. So
Yeah.
like my dream of medicine is having a place where everyone, like a lot of people will see me and they'll also see my colleague for massage and then another colleague for hypnotherapy, another colleague for shamanic healing, another colleague for chiropractic. And we all see each other too. So it's nice, like we take care of each other. We all take care of the garden and the fish and like it's and it feels really cozy. I wanted to create like a wellness center that didn't feel sort of sterile. It's very clean, but
Yes.
it's very like lots of colors, lots of vibrancy, lots of things from around the world.
Yes.
You just
That's what
it's
I love about your space. Like
it's
when
like
I
a
come
sensory
in,
delight.
yeah, when I
Yeah.
come in, I do feel like I'm in like someone's home in a
But
way. And
yay.
then there's all these cool like crystals and tinctures and beautiful things to
Yeah.
look at and the fish and the plants. And yeah, you really have created a space that feels like a home
Oh,
in
thank
the best
you.
way. But you're right. I mean, it is sterile and clean and
It's
all.
sterile clean, but like one of my favorite things is some people will like come early for their appointments and bring a book or bring a computer because they're like, I just want to have sit here and have tea and get some work done, or can I stay later, or can I go in the garden and hang out? And so that's very much that community feeling of like people feeling like it's a place that you get for support on many levels, but that you also want to hang out. Um,
Yes, yes.
yeah. So
Right. You've created
so
like a team, like a wellness team.
yeah.
And yeah, there are different, like all these different things that like all come together to help overall health.
Yeah. And I love that. And, I'm not a boss. Basically, everyone runs their own business there. And so another thing that I know you share is just really empowering other small businesses. So it's basically a bunch of small businesses that work together under the umbrella of Source Point Wellness. So that makes me super happy.
Yeah.
So I've been there since 2019 and, we'll be there indefinitely. But I do also do telemedicine all over the world. And we can talk about some of the acupuncture Reiki that I do, where I can do the
Yes.
acupuncture all over the world as well.
Which
Um,
is so cool.
so yeah, so I'm kind of a combination of like, we'll talk about it, but
Yeah.
like I love labs, I love science, and I also love magical things. So they kind of intersect in my head and heart.
Yes. And I think
So
that's what makes you so great. Is like
Oh, thank you.
you're coming kind of from all the angles.
I
Uh,
try.
yeah.
Yeah. Yeah.
Great. So why don't you tell us a little bit about your background, like kind of where you grew up, and also you can lead into like what got you
Sure.
this path. Yeah.
So currently, I live in Los Feliz with my husband and my son and my three feline children. Um, and I, my son's two, his name is Charlie. And anyway, I could go on and on about Charlie, but I know this is
Yeah.
about my work. So I grew up in LA, and I um love LA. I went to college at Cornell in upstate New York. And I also went in LA, I went to a very a crossroads, which is very thinking outside the box, very much in touch with the emotional, spiritual aspects of being a teenager. So I was from a young age really taught to um, really feel like what feels right to me and not just kind of go with what I should be doing.
Right.
Um, but I still kind of did that. I went to Ivy League, Cornell, very rigorous, loved it, enjoyed the seasons, loved my friends. And I was like, well, I'm a psychology
Enjoyed
major.
the seasons. That's funny.
I know. I feel like we have them
Definitely
now.
an elegant.
Um, I know. I double majored in cultural anthropology and psychology. And so I was like, well, I'm a psychology major, so I should just go to grad school for psychology. But I didn't really like think about it. So I ended up going to UC Irvine, which is a very research directed program, and studied health psychology and psychopathology, and really started to see through research how much physiological stress just like impacts everything, like our hormones, our cortisol, our brain function. We
Mhm.
would literally in the labs like stress out students and measure their cortisol levels and their heart rates. And
What?
yeah, we made them we would wear lab coats, or and then we would make them give like a 5 minute talk off the cuff and just stare at them and make no expressions. And we would measure their heart rate and their cortisol through the saliva and blood pressure. It was terrible. But um, it really got me thinking like, wow, there's such a body connection. And I love the program, the philosophy of the program, in the sense that it's the Department of Psychology and Social Behavior. So it's trained us to really think of, even though it's research based, but like how a person's home, community, city, um, environment really affects their mental health and physical health. But it was all research. I was at a computer all the time, and I was like, I really miss people. I'm spending a lot of time at the computer running statistics. So I
Yeah.
decided to get my master's at UC Irvine and then take a leave of absence and transition to Chinese medicine. And I studied at Emperor's College in Santa Monica. And it was so different because academia is very, it's a little cold, competitive. And I remember one of the first days or weeks at Emperor's, I was sitting outside studying my like herbal flashcards, and this guy was like, "Do you mind if I play my Native American flute next to you?" And I was like, "Oh, this is it's like so glorious." So it was just like it was hard. It was super hard. I had no idea
Yeah.
that it's like medical school, but it's like you learn all the Western things, but then you also learn Chinese herbs and acupuncture. So it was a lot, but
Yeah.
it also had like a huge spiritual component, which was great. So got my master's there, got my doctorate there, specialized in functional medicine. So I was in school for 16 years, um, post high school.
Yeah.
And then, yeah, set up shop in, yeah, I think 2013.
Wow.
And so anyway, I love it. I love my job. I wake up every morning excited. The patients I've been working with, I've known a lot of them for since the beginning. And it's like one thing kind of heals, then we move to the next. So anyway, I
It's
love it.
always like it's like I don't know, I kind of like to describe it as like we are like cars, right? And we
Yeah,
constantly need like tune-ups and oil changes, and
absolutely.
sometimes there's little accidents, and we have
See,
to like
um,
take a continuous journey,
yeah,
keeping
for
ourselves
sure.
maintained, keeping health,
Yeah.
you
And
know.
I think so much of what I've experienced myself, and I can go a little into why I chose this path
Yes. Yes.
personally, but is that I love the mind. And I felt that I've always loved psychology. I think it's fascinating. I love people's history. I love meeting new people and like getting their story and just kind of uh like integrating that. Like basically I spend every time like at least 25 minutes. First visit, we spend like an hour talking, getting
Oh
like
yeah.
everything. I want to know everything.
Yeah.
And then each visit, it's like it's like therapy, but then we integrate what we talked about into the acupuncture session. And I explain like what we're doing. So
I
even
loved that when I first met
yeah.
you and had my first session with you. You really sat down with me. You gave like, you know, maybe like a full 90 minutes.
Mhm.
And I felt really cared for, like, oh, you care
Mhm.
about my history, and traumas and whatever
Mhm.
it is. And you really, I feel like now every time I see you, you have like a really comprehensive kind of background knowledge of me. And I feel very cared for. It's not something that's just like in and out,
Yeah, like
I,
how's your digestion? How's your head? Okay, lay down.
yeah, yeah,
It's like I care about like all aspects of you. And a lot of the people that see me are spiritual, but you don't have to be. I mean, that's the thing. Like it's completely, of course, like I can address pain, but the juiciest part is like once the pain clears, like what's underneath.
yeah.
And I do find that a lot of probably 75-80% of my patients have had significant trauma that they have been storing in the body. And it
Mhm.
creates blocks into a lot of issues in their love life and career. And to sort of help them, of course, move out the pain, but kind of start to hold space for and peel off some layers gently to kind of be able to free them from some of that
Getting
the
to like the root of
yes, yes,
the cause.
absolutely.
Yeah.
So it's very exciting. It's almost like, okay, pain done, let's get to the juicy stuff. Like that's
Yeah.
why, like, so what do you really want to do with your life? Like how,
Right.
like I don't know, I get so excited about that. um so quick sort of summary of my um
What got you to,
entrance
yeah.
into this is that I've always loved herbs, natural medicine, found it fascinating, was a child who was always had like some weird stomach issue. I had migraines growing up. I had debilitating migraines for a lot of my 20s, especially when I started grad school, and so bad that I was getting MRIs. And I had literally shrunk my hippocampus, which is like someone who's been in extreme trauma. Like I was just in chronic fight or flight. And there's so many reasons that I was in that space.
Yeah.
Um, I mean, that's like a whole book essentially. But I would just like to say I don't have migraines anymore. Um, I get them maybe a few times a year if I have really overextended myself or I'm like really overwhelmed, or I think a spider just landed on me. I don't know. Whatever, creativity. But it's so rare. But I was at a point where I was getting them daily and I was so depressed. I felt like someone was squeezing my head and stabbing me behind the eye. And so one of the things I specialize is chronic headaches and migraines because it is horrible. Like it is horrible. And a lot of doctors are like, oh well, like that's just the way it is. Like there's so many different causes of that.
Yeah.
So just through that journey, I also had chronic pelvic pain. I
Mhm.
don't have that anymore. You know, big pelvic floor therapist advocate here.
Yeah.
Um, but there was a lot of stuff with my microbiome that was created. Like there was so many things that I felt so alone. My mom would come with me to the appointments. Like it wasn't about family support, but I felt like unseen, unheard by the doctors. Like, oh, you
Yeah.
should just meditate more. Like you're just gonna have to deal with it. And like I love meditation. I do it every day, but like you can't I don't think meditate your way out of a severe migraine. Like I think maybe it
Right.
could lessen, but like there's probably a reason that
Yeah.
you're getting them all the time. Is it neck pain? Is it it's like kind of pushing out like back in here to the back of the eye? Like are you grinding your teeth? Are you have food sensitivities? Like how's your relationship? Like there's just all these things that are like factors that sort of need someone needs to ask those questions to help peel away like the why.
Right.
Um and so like my goal is to as a physician like my everyone who's in my care, it's like you're in my wings. Like I'm like a part Jewish, part Italian. I'm like cozy grandma. Um, and but I also feel like my most important thing is that people feel seen and heard and validated and understand why they feel the way they do.
Yeah.
And if there's herbs or when we do functional medicine, if we see there's some imbalances, why are you taking that pill? Like, do you understand you've been feeling this, and this? Like are you anxious? Do you have headaches all the time? Are you hangry? Do you have PMS? Like how's your blood sugar? Is it going like this?
Yeah.
There's just certain things that are like so like oh my gosh, like this one thing like is affecting so many areas of my life that like no one's just like looking at the full picture. I mean, I am, and I know there's a lot of great doctors out there too, of course, but I think that what I do, and especially like when we look at labs as well, is I spend an hour going through labs with people to say, do you realize you're so tired because your iron is so low or you're fighting off this bacterial infection? Like people are like, oh my God, like my doctor said I was fine. And you're telling like, I'm like, of course, like, and then guess what? Like, we put them on the right supplements or herbs, and I try to not like dump a bunch of supplements on people. I also give medicinal foods, and guess what? They feel better. Like,
Right.
so,
Right.
um, but yeah, I feel like I try to create a really cozy environment. I I have an amazing virtual assistant. Well, she's my friend, but like she does my admin stuff, but like I like to do my own scheduling. I like to do my own emails. Like I like to have the accessibility for people.
Yeah.
Um because I think it's like a process of healing, especially if there's trauma, like you don't want to feel like, oh, you can't talk to your doctor for like 3 weeks. Like it's like if there's an emergency, I will get on the phone with you that day. Like it's, I mean, I'm not a heart surgeon, right? But I mean, there's a
Yeah.
lot of stuff that can come up. So I don't know. I just
You know,
wanted to
I
be
think
like
having
cozy.
being feeling heard and seen and having somebody just hold space for you is so healing in and of itself. Just to finally
Uh,
feel like, oh, somebody believes me, or
right.
there's
Like, of
other
course
things
you
to
feel
look
this way.
into
Yeah.
besides just the like, like the baseline stuff. And I think, yeah, with Western medicine, they're really good at finding like critical, acute,
And it's amazing.
life-threatening
Like,
beings.
yeah.
It's fantastic and amazing. But then the more subtler things, I feel like, you maybe have these little red flags, but they're not really like dealt with because
Mhm.
maybe they can't be treated with medicine right away.
Or you wait till it's out of range to treat it. Like,
Exactly.
let's
Yeah.
just watch it.
Where
It's like, no, let's,
until it goes into the
yeah.
red, and then, oh, here's these pills to deal with those symptoms. It's just like a totally
Yeah.
different way. So I think what you do is really important for people because I'm sure you get a lot of people that have tried all the other things and then they're like,
Yeah.
well, let me try
Oh
this.
yeah,
Let me try this
they're like
acupuncturist.
they're like, oh, I've done acupuncture, it doesn't work. I'm like, listen, honey, you haven't seen me. And listen, I feel like I'm a vessel. Like it's not even, it's just like I know I I don't I feel like one of my superpowers is to be able to like really be present with each person that I'm sitting with and almost like channel, okay, like what is happening? I'll get like I can see people's labs before I order them essentially, but I like that.
Yeah.
Um, I know it sounds out there, but like it's true. Like I feel like
You have an
I
intuitive
I
aspect.
have an intuitive aspect, but I do love science and I need that. that part of me that's like, I'm never going to give someone a supplement like I muscle testing, a lot of people do that. I don't do that in my practice. I like to see the actual data.
Right.
Chinese herbs are different. We look at the tongue, we feel the pulse, and but I think that why I feel successful in my practice is that I do really get to the root of
Yeah.
what's happening. And it's like, if these three things are not in balance, then this, and this happens. And a huge thing that I see in my practice is thyroid, where people like their labs look normal, but they feel so tired or they're gaining weight or, you know, um, they're depressed. And it's like, then I look at their labs and I'm like, of course, like this
Yeah.
is subclinical. Like this is like, we look as a functional medicine doctor, I look at optimal ranges. So that's way more narrow than what you would see with the standard lab. That is the average American is like basically sick. So when you're in range, if
Mm,
you're like towards the bottom or towards the top, like you're probably still having symptoms.
mm,
So,
mhm.
um, and so that's why I spend time going through labs of people, because I'm not going to say, here, take this, take this. You have to understand, like, you feel this way because this is low. And,
Yeah.
you know,
Yeah. Awesome. Thank you. Okay, so let's go into like, for those that don't know, what is acupuncture? We'll just start there.
okay. So I love acupuncture so much. I love talking about it. Okay.
I love
So,
it's the best.
so we have, I mean, there's so many ways to talk about it, but, we have our nerves and we have our arteries and veins, and you can almost think of another layer of, of flow. And essentially, like there's so much research on acupuncture. They can actually like, I'll just say this because I feel that this is a really cool thing. Um, they there's certain points that activate different parts of the body, and a lot of the points on the leg activate the head. So they did MRI studies, and there's a point on the inside of the leg that it means bright eyes. It translates to bright eyes. And so when they did this point, they, inserted the needle this point and did an MRI, the back of the brain, the occipital lobe, which is in charge of vision, lit
Yeah.
up.
Wow.
So it's so freaking cool how it's like you can't
Scientific.
see it,
Hmm.
right? But we see, like, I can tell you, like, someone cannot move their neck. I'll put points in their foot and in their leg, and then they can move their neck. Like
Yeah.
there's stuff there. So basically, to make it like scientific and boring, um, acupuncture works by stimulating the immune system. So we have these meridians, which are these pathways, kind of like nerves and arteries, but that you can't really see them, um, that they have acupuncture points along those meridians, and each point has a function, but every point has multiple functions. So, for example, one point can do 10 things. So you get a lot a lot of benefits. Even if you're doing 6 points, you're getting a wonderful treatment.
Right.
So when you insert the sterile needle into the point,
Mhm.
it signals the immune system like invader, and then blood flow goes to that area to like um like greet the needle, be like, excuse me,
Yeah,
what's
yeah,
happening
yeah.
here? And it's like a button that turns on. And so, for example, that one that I talked about for vision, that one also balances the hormones, supports your adrenals. Like, of course, it helps. The kidneys are related to the eyes, so like it would brighten your vision. So, another point I do for shoulder pain also supports the bones and the marrow, and I use it for creating boundaries in people's energetic field. So it's just like, that's what's so cool. It's like each point, when you insert the needle, it's like all these helpers just get released throughout the body, and it's just a beautiful thing. And even I mean, I was seeing patients even before I was licensed, because we had a clinic, and it's amazing to me, like someone comes in with a migraine and it's gone within under a minute. Like, if it's
Incredible.
like, and if it's not, then I'm on the wrong meridian.
Right.
it's like, oh wait, it's better, but it's not quite. Or sometimes it'll move, so I have to like chase it out a little bit. It's like
Uh-huh.
it's so I had to add another point. I don't know. It's very much like I would imagine I'm just starting to get into cooking. Oh my God, after 41 years or 42. I don't know how old I am. I think I'm 42. Um, where I could imagine just like a chef like adding spices. Like that's how I feel. Like I'm like, oh, let's do this. Let's do this. Like,
Gonna say when you are working on someone, it's very much like I see you get into this kind of zone
yes.
and yeah, you're like, how's this? How's this? Okay, let's do this. Beep, 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 beep. And you just like know all the little spots. And as a person receiving it, I can say it is tangible. Like you've done the points because we've been working on my neck. And there has been times where I just automatically feel, I guess it's the blood flow to
Mm-hmm.
the energy moving to my neck.
Mm-hmm.
And then you'll literally in real time like come and feel the muscle and you're like, oh, okay. And then it releases, but
That's
you're not even
like,
anywhere
yeah.
near my neck. You're like
I
on
know. And that's the coolest part, right? Because like how can I see if your neck pain's better if I stuck a needle in your neck? Like you can't move it.
right, right.
So I love my teacher, Dr. Robert too. I have a lot of teachers, like he's one of my main ones, but he taught me, I practice what's called classical acupuncture. So we do points a lot on the lower legs and lower arms because fingers and toes, because they have the most gravity and the most juicy blood.
Mhm.
So if you have neck pain, I'm working on your legs and feet. And then that way, like, because it's basically like bottom treats top, top treats bottom, left treats right. And so it's all very cool. It's very mathematic.
Yeah, yeah.
Um, but I love that when someone comes in and like I squish their shoulders and traps up there, and I'm like, good God. I mean, I
Feel
don't
it
say
in
good
real
God. I'm like,
time.
and then I'll like do the points on the leg, and then it'll be like butter.
Yes,
And it's like, oh, so good.
yes.
Um, so
Also,
one of the, oh yeah.
go ahead. Go ahead.
No, I just sometimes like I think it's like not always the best experience, but I think it's actually really good. Like, do you remember how um like I treated you and then we our neck and the next day you felt like you were getting sick?
Yes.
And that it was like all these toxins like coming out, and then the next day you felt amazing.
Yeah,
That's like
thought I
it's
was getting sick. I was like, oh no, I think I'm getting sick. I felt
yeah,
awful that next day. And then, though, the day after, I woke up and felt exceptionally better. Like,
yeah.
I woke up and was like, I'm gonna run and like do all these things. And that's
Hmm.
when I was like, wait a minute. Oh, yeah, I think it was a
Well, because
reaction.
the thing is like I try to move stuff out through the poop. Like I'm always about that. But like if you've had tension for a really long time and it gets released, like sometimes it takes just like it said it takes 12 hours or like for it to leave the body. And so it's like that's something that I just want to tell people about acupuncture. If you try it with me or whoever, like you if you feel like crap the next day, it's not a bad sign. Like if you feel more
Right.
sore or you feel like so tired, it's actually all these toxins that were stored in your body releasing. You just have to drink a lot of water. Of course, like, lay low, do what feels, but just kind of Epsom salt bath, and it should feel like a ton better the
Yeah.
following day.
Yeah.
Um, and always just like talk to your acupuncturist, like, hey, I'm having this response. But
Right.
when this happens to people, I'm like, I know this sucks, but it's actually really good because it's like it was really deep inside and now it's like moving out and your body's like really working hard to like move it out.
Yeah.
So yeah, it's just interesting. Sometimes I just don't want people to like be off or scared of
Yeah.
that if they've tried
Oh,
it before and they're like, I didn't. I felt like crap the next day. I'm never doing that again. Like, just know that's not even a bad sign. It doesn't happen every time. It usually
right.
happens the first time.
Yeah.
Yeah.
It's yeah, it's
Or
I
if it's been a
now that
while and
I
there's
know
been a lot
that,
of stress.
right. And now that I know that, I feel too like it was like around the holidays,
Yeah.
I was eating more
Mhm.
just like crappy things I don't normally eat. I was drinking more alcohol than I
Yeah.
normally do. And I think that's, it was just like, and I felt kind of like bogged down. And,
Yeah.
it makes sense after I realized what
Hmm.
strengthening.
Yeah, it's like we're strengthening your immune system because it's like when your body's tired, just holds, right? So you get inflammation and you get bloating and all this stuff. So if someone like releases the valve, it still has to come out some way, you
Yeah.
know?
Yes.
So
I
it's
feel
just
that
it's
way like with emotional stuff too. Like when I first
mhm.
started doing yoga and like think
Mhm.
about chakra release and things, like at first I'm like, oh, I like cried and I felt, and now I'm like, oh, I'm having an emotional release. Yay.
Yeah, I welcome it actually
Yeah.
because I think that I've always been someone, I think now I have really good self-care and really take care of myself and in ways that I didn't when I was younger. But I would have chronic anxiety all the time. But it was a lot of it was masking sadness or anger or, other things, not feeling worthy, not being enough, all of these like deep, deep things. And so taking time to really unearth that with the people that I've worked with and now people I help people do that too. Like you get to the other side and you're like, I'm so nice to myself. Like like I think when I was so mean to myself, like when I get at someone and they have like, I'm like, oh my God, like I promise you, like you can shift this. Like it's such a beautiful thing seeing someone transition from like sort of the self-sabotage, wait,
I think that's correct. Yeah.
yes.
Deprecation.
I was like, defecation, no.
No.
No, no, no. I haven't had my matcha yet. Um, so I think that when you start to see them like, I took myself on a hike, I went to the movies by myself, like I took a pottery class, like I started working out,
Yeah.
like these things, I'm like, yes, you know,
Yes. It's also a shift too. I feel like if you grow up with a lot of trauma or chronic issues, it almost like becomes your identity,
yes,
And so you get used to feeling like crap. And maybe that's like your new bar. So you
yeah.
don't realize it. And then when you start healing, physically, mentally, emotionally, like, and you start feeling better more than not, you start to then, I feel like there's a point where you have to start identifying with actually feeling better. And then you
Hmm.
kind of like, now it's like I expect to feel better. And when I don't, I'm like, oh, I need to, I'm putting myself on the back burner. And
Yeah. Yeah,
like,
your body will tell you.
yeah. So it's almost like you get addicted to feeling good as opposed to
Mhm.
like you're kind of, I don't know if the addiction's the right word, but
Well,
like,
it's a new norm, right? So the new norm
yeah,
is that, and
yeah,
I think that some of the things too, because I'm always talking about like this is what I see, is that the pain is gone, and but now what? I've had this pain for 20 years, like, and
yeah,
there is sometimes a healing crisis that goes with that. Where like, who am I without this pain? And you
yeah.
think you'd be like frolicking through the meadows, but sometimes it's like I don't know who I am. Like I have all this time now. I'm not going to all these doctors. Like, what do I really want to do with my life? Like, you know what I mean? They're just
It's almost like maybe a grieving process too.
yes,
Mhm.
because it's part of your identity. And I know that's like obviously you don't want to have a pain identity and all of these things,
Right.
but it's just it opens
Yes.
up space to really look at some other aspects of your life that sometimes can be scary because you've been so focused on the pain you haven't looked at your job or this issue with your family or it's like you don't have time because you don't have capacity, but it's like now your cup is full, the pain is lower, like what
Yeah.
oh
Like,
I've had people I quarter my patients have switched careers. um they come to me with like pain, like knee pain, and then they're like, now I'm I'm a writer and I'm studying shamanic healing. And, I decided that, one of my favorite stories was one of the questions that we talked about before was that I love her so much. I love all my patients, but anyway, so she came to me for constipation. When she started pooping, she was like, oh my God, like such an incredible healer. And she went from corporate job, but that she's going to be starting acupuncture school.
amazing. Yeah.
I was like, I'm gonna give you my lab coats. Like you can have my highlighters. I'm so excited for you. Um,
Yeah.
so and
Yeah.
like that is to me like, oh my gosh, like wow, that's just so incredible.
Yeah.
Um,
And it all goes to the story too, right? Like we get so like, I'm this, I went to school for that.
yeah,
I need to do this, but why is my body, like our
your
bodies are
body,
so wise, like they know and
I know.
they're just trying to like, hey, let us know.
Yeah.
And I love that I take it as like this like challenge, like, oh, what is,
Mm-hmm.
when I work with people, I'm like, what is their body trying to say? Or,
Mm-hmm.
you know, uh,
Absolutely. Absolutely.
so let's see. We have a little bit of time left, and I would like to hear just a short kind of like synopsis because you do acupuncture with Reiki and you're able to do acupuncture via Zoom and
Zoom phone, text.
yeah,
Yeah.
and stuff like that.
Yeah.
And a little bit about that.
So my in-person services are acupuncture with needles. I also can do basically I can do Reiki on the acupuncture points, herbal
For
medicine.
people that don't know, Reiki is an energy healing, is like an
Yeah,
energy.
so it's like you basically like chi is the Chinese word, ki is the Japanese word. I mean, that's so simplification, but basically you're bringing in energy to activate that point. Because I have a lot of people that are scared of needles. So I use these stickers that have magnets to amplify, and then I like do Reiki over that and
Is it
same results.
possible to do Reiki without actually using the needles?
Absolutely. You mean acupuncture without? Yes, absolutely. Yeah. And I actually treat infants, I treat kids. Some of them needles, some I do. I mean, it just depends, right?
Okay.
Actually, babies are great with needles. Let me just do them for a second. And then I do functional medicine labs. I send people to a lab, get their blood drawn,
Yes.
hormones, all that stuff. Okay, so that's kind of my in person, and then that's half my practice. My other half is that I can do telemedicine anywhere in the US and Canada with functional medicine, order labs and do the analysis, that thing. The thing that sort of developed during COVID is I worked in person throughout COVID, pregnant, um, and
What a crazy time.
vomiting every day. And there was a lot of people that, moved away or were too afraid to come in, even though I have a lot of open windows and doors, like people just a lot of people came in person, a lot of people didn't want to, but I had people on the East Coast that got COVID, couldn't breathe that well, having anxiety, having migraines. So I started just practice on my friends where I was like, if I can do Reiki is something that you can actually um, send healing to somewhere anywhere and to someone anywhere in the world. And also you can work on different times as well, but let's not get into that. Anyway, so I was practicing. I was like, well, if I can do Reiki, I was practicing with my friend in Brazil. Um, let me see if I can activate the points through Reiki virtually. So I started to, as COVID and Black Lives Matter and everything, I was just like pro bonoing. Like I was like, I'm going to practice this for a year, all of 2020. Like I just was like, I just wanted to be of service to people. And so I was working on people in Africa, like shoulder, she couldn't move her shoulder. We were on Zoom in a minute. She was able to move it. I
Incredible.
worked on another person there. I had someone in Copenhagen. I had someone, um, a lot of people in New York, trouble breathing, anxiety, sleep, back pain, all the things. I was like, this works. This is
Yeah.
amazing.
Yeah.
This takes very short amount of time. So it's called High Priestess Healing. It is really freaking cool. I have spent 2 years teaching people how to do it. And then it's another thing that I'm going to be launching again this year. You don't
And
have to be an acupuncture.
like is it like a certification to
Mhm.
be able to practice?
Yeah, so it's basically for people you don't have need to have any medical background. I taught it for 2 years. Everyone I taught is amazing at it. I basically teach how I do acupuncture through Reiki.
Mhm.
And so now they all know how to address, stomach issues, all the pain, but we also teach like existential issues, like how to, I do that anyway, but like how to your sense of self-worth, attachment issues. I also work on the chakras. So I do a lot of work with goddesses. So there's like I said, there's like a lot of integration of spiritual, esoteric stuff, but then I do love science. And
Yeah.
it's so what I'm working on this year is sort of really it's putting that forward in how I present myself because it's been kind of functional medicine, spiritual stuff, and I really want to bridge them a little bit more. I mean, I do with a lot of people I see, but I think that people sometimes, oh, she's way too out there. I don't know. She does labs. I'm like, I'm really good at labs. And people who see me for labs don't know about the spiritual stuff. So it's kind of like a reintroduction to like how I can help people on different levels.
Yeah.
Is my 2024 goal. So,
Love it. That's fantastic. So people anywhere can work with you.
yep.
Okay.
Yeah.
All right. And so just to end here, is there a quick and easy wellness tip that you can share with us? Something, that we could easily do maybe on a daily basis that would benefit our health and wellness.
Yeah, I'm just going to show 2 points that are really easy to do. And I use them to, like, a lot of times we talk about grounding to the earth, but this will help people ground to themselves because I think that a lot of times we're like octopus, like energy. So the first point is called small intestine 3, and it's on the pinky side.
Does it
And
matter
it's,
which hand?
mm-mm. So this basically strengthens your spine and brings you back to center. So it's right here. So it's on the side, like right there. So this is like a strengthening, zip you back up. And then the other one,
And so would you just kind of hold, close
just,
your
or
eyes,
you can do what's called coning, where you take your other fingers and just kind of hold it over. You don't have to get right on the point, like
get a
right
roll?
there.
Yeah.
That's small intestine 3. And then the other one zips up the front and it's called lung 7. So see my thumb here? It's on the thumb side. And do you feel like there's like a little bump?
Yes.
So right on the inside of the bump, like on the,
The little like divot.
yeah. So it's like right there, right on the inside of the bump.
Okay.
So this helps bring it to the back to you. So if you feel really overextended and you need to center real quick, you would do boop, and then I'm doing the coning of my fingers, and then boop, and it just like helps bring it all back. Um,
Do that
and
next.
sometimes you could do this one in between your forehead too. So you could do like it's
Is it
called
in
yin tong.
the middle?
Yeah, you could do right in the middle. I do a little higher. So right here. So you could be like, okay, I'm feeling really scattered. Let me just center myself really quick. So here, and then on the thumb side, then this guy, and then this. And it will take you like 3 seconds, but it's just helps you if you're feeling, it's really good if you're just feeling overwhelmed, really like not present and or you just need to get focused, like that's really helpful. I have a more
I
expansive
love
version
that
of that, but that's
little
like a quick
magic.
um
Magic.
yeah. And so clarity, strength, um self-love is what they do.
Uh,
So but so
cool.
much
Thank
more
you
than
for sharing that.
that. Sure.
Next time my kids are gonna be like, "What's mom doing?" Mom.
So this is small intestine 3, lung 7, and yin tong is what it's called. So little
Gosh,
triangle. Boop.
cool.
So
Well, thank you so
welcome.
much for sharing all of your knowledge.
Of course.
I will put your website in the caption so people know where to find you. And yeah, so have, you know, if you have been trying to deal with certain aspects of your body, your health, but it's like emotional and mental too, definitely reach out to Dr. Amanda Cohen because she is
Yeah.
fantastic.
Thank you.
I just absolutely love my sessions
Aw.
with you. And yeah, and I know a lot of people that go to you too and work with you, and everybody just loves Dr. Amanda. So,
Oh, thank you. I love you.
so thank you so much.
Of
And
course.
I can't wait for my next session
I
with you.
know. Me too. Okay.
All
See you
right.
soon.
Thank
Okay.
you.
Of
Bye.
course. Okay. Bye bye.